Netter's Concise Orthopaedic Anatomy, 2nd edition, is more than just a textbook. It's a vital tool for anyone looking to master the complexities of the musculoskeletal system. This book stands out for its clear and concise approach, making it ideal for students and practitioners alike. Whether you're a medical student navigating anatomy for the first time, a resident preparing for exams, or a seasoned practitioner seeking a reliable reference, this book has something for you. The 2nd edition builds upon the strengths of its predecessor, incorporating the latest anatomical knowledge and clinical insights. This edition retains the high-quality illustrations that the Netter name is renowned for, further solidifying its reputation as a must-have resource. With its user-friendly format and clinically relevant content, this book promises an engaging and effective learning experience. One of the most striking features of Netter's Concise Orthopaedic Anatomy is its stunning visuals. The book is replete with full-color illustrations by medical illustrators who have meticulously crafted each image. These aren't just aesthetically pleasing, they are meticulously accurate representations of anatomical structures. The human brain is wired to process visual information more effectively than text alone. These illustrations leverage this by transforming complex anatomical relationships into easily understandable visuals. For visual learners, these images are invaluable, providing a clear and memorable understanding of spatial relationships, muscle attachments, and joint articulations. The brilliance of Netter's Concise Orthopaedic Anatomy lies in its ability to distill complex information into easily digestible portions. The text is clear, concise, and avoids unnecessary jargon, making it accessible to learners of all levels. Complex anatomical concepts are broken down into smaller, more manageable chunks of information. This approach ensures that readers can focus on understanding the fundamental principles of orthopedic anatomy without feeling overwhelmed. Each anatomical region is accompanied by detailed descriptions of bones, muscles, ligaments, nerves, and blood vessels. The text is strategically placed alongside the illustrations, creating a seamless link between visual and textual learning. Section 4. A Journey Through the Musculoskeletal System. Netter's Concise Orthopaedic Anatomy takes readers on a comprehensive journey through the human musculoskeletal system. The book is organized systematically, starting with the fundamental principles of orthopedic anatomy and progressing to cover specific regions of the body. Each chapter is dedicated to a specific region: the upper extremity, lower extremity, spine, and pelvis. This organization allows readers to focus on one area at a time, building their knowledge progressively. For example, the chapter on the upper extremity covers the shoulder, arm, forearm, wrist, and hand in detail. Similarly, the chapter on the lower extremity delves into the hip, thigh, leg, ankle, and foot. Section 5. Bridging the Gap. Anatomy and Clinical Practice. What sets Netter's Concise Orthopaedic Anatomy apart is its emphasis on clinical relevance. The book seamlessly integrates anatomical knowledge with clinical applications, highlighting the importance of understanding anatomy in the context of patient care. Throughout the book, readers will find clinical correlations boxes that provide real-world examples of how anatomical structures are relevant to orthopedic conditions and procedures. For instance, in the section on the shoulder joint, the book might discuss common injuries such as rotator cuff tears or shoulder dislocations, explaining the anatomical basis for these conditions. This approach ensures that readers not only memorize anatomical structures but also understand their clinical significance. Section 6. Beyond the Book: Online Resources for Enhanced Learning. Netter's Concise Orthopaedic Anatomy goes beyond the confines of a traditional textbook by offering valuable online resources that enrich the learning experience. The book provides access to an online platform that supplements the content with interactive features and additional learning materials. This online component includes a comprehensive image bank, allowing students and practitioners to test their knowledge of anatomical structures and relationships. The online platform also features clinical case studies that challenge readers to apply their anatomical knowledge to real-world scenarios. These case studies present patient histories, physical examinations, imaging studies, and treatment plans, encouraging readers to think critically and make clinical connections.